Welcome to the Part D Coverage Stages edition of Medicare in Minutes, a micro-learning series brought to you by Action Benefits. Medicare Part D is confusing to most, as individuals will experience price changes while working through the various stages of Part D coverage. There are 4 stages within Part D coverage: the annual deductible, initial coverage, coverage gap, and catastrophic coverage. The first stage is the annual deductible, which always starts on January 1st. During this stage, beneficiaries are responsible for the full cost of the prescriptions. Once their spending accumulates to satisfy their deductible, they will move to the second coverage stage. If a Part D plan does not have a deductible, beneficiaries begin the year in the second phase of coverage, the initial coverage stage. This phase applies cost sharing to the individual's prescription purchases. During initial coverage stage, the Part D insurer has some responsibility to offset the cost of prescriptions, meaning the plan will pay a portion of the cost and the beneficiary will be responsible for either a fixed dollar copay or percentage coinsurance. The beneficiary's financial obligation will depend on the drug tier's classification within their Part D plan's drug list or formulary. The initial coverage stage ends when total expenditures, those of both the carrier and the individual, add up to the initial coverage limit set by Medicare. This limit is revisited annually, so check Medicare.gov for the most up-to-date figure. To be clear, premiums do not count towards this limit. If a beneficiary has a deductible to satisfy within Stage 1, this amount does not apply towards the individual coverage stage. Once the limit on covered drugs has been fulfilled, the individual will move into Stage 3, the coverage gap. This phase is a temporary disruption in how prescription costs are shared between the plan and member. During this phase, drug manufacturers shoulder some of the expense, while the beneficiary and Medicare pick up the rest. Contributions from the beneficiaries and the amount contributed by the drug manufacturer is submitted toward their out-of-pocket limit. As of January 2020, Medicare Part D beneficiaries will pay 25% of their brand name drug costs while in the coverage gap. 70% of the drug cost will be covered by the drug manufacturer, and 5% will be paid by the beneficiary's Medicare Part D plan. Once again, costs paid by the beneficiary and the manufacturer count toward out-of-pocket limits. For example, if Tariq hits his coverage gap and purchases a brand name medication with a retail cost of $100, he pays $25 for the medication and receives $95 in credit towards meeting his yearly out-of-pocket limit. In comparison, if Tariq purchases a generic prescription while in his coverage gap, he is still responsible for 25% of the drug cost. However, only his expense is applied toward the out-of-pocket limit. Beneficiaries exit the coverage gap when their total out-of-pocket costs, not including plan premiums, reach the true out-of-pocket maximum, or TROOP. TROOPs are revisited annually, so check Medicare.gov for the most up-to-date figure. Accumulations counted toward the TROOP include all money applied toward the annual deductible, all copayments and/or coinsurance, as well as individual and drug manufacturer costs incurred in this third stage of coverage. The final phase of the Part D prescription drug coverage is the catastrophic stage. Starting in 2024, beneficiaries will no longer be responsible for the 5% coinsurance that was once required of them in this phase, leaving beneficiaries to pay nothing for their drugs in this phase. This essentially makes the catastrophic phase a cap on drug costs. Part D plans, however, will be picking up for that 5%, bringing their total cost to 20% in this phase instead of the 15% that they once covered. In 2025, spending for beneficiaries will change again. The coverage gap will be eliminated completely, and beneficiaries will go right from the initial phase into the catastrophic phase. This phase changes too. It will now have a $2,000 spending cap. This cap will change every year, so it is important to check Medicare.gov for the most up-to-date figures. But basically, starting in 2025, beneficiaries will only have to pay approximately $2,000 for their Part D drug costs in the initial coverage phase. Then Medicare, the manufacturer, and their Part D plan covers the rest in the final phase. While shopping for Medicare can be a nerve-wracking experience, you can take steps to prevent some stress associated with affordability when working with a knowledgeable agent. Questions regarding this and all other Medicare topics can be directed to your agent. Thank you for watching.